our second option of training for Oral Clean. And Tracy Smith is the project lead for this product line. As you will see, many different people coming forward as project leads for some of our new manufacturers, like Katie Justice is over SedMed. You'll see Devin over Beacon Light, and George Godfrey over about 4 product lines here coming up. You'll start to see some things coming up from him. So we're excited to have Tracy. She's kind of been with Oral Clean since day one, helping facilitate a rollout at Tampa, which, as you guys know, requires feet on the street and daily and weekly interventions with the VA to get things done. So she's kind of your go-to guru for product questions and coordinations with the manufacturer. Cindy is also clinical support in the field. That's why she's traveling. And Tracy, I'm going to pass it over to you. Guys, you've got all the resources on the share drive. We've already had a success story post first training, so we're excited to bring this opportunity and a very important product for patients to this team.
Thank you, Debbie. Yeah, I'll make some introductions real quick. We have Gary Lauterbach, who's the CEO of Oral Clean, on the call. He'll be helping us do the presentation. He spent a few decades building and scaling medical device and tech companies as a CEO and chairman and sales exec. We have Kirk Kensler on the call, who's the COO. He's an engineer by trade and has many, many skills, including a 6 Sigma black belts. He's certified. And also standard compliance and FDA regulatory medical devices. And we might have Dr. Virginia Prendergast joining us if she is able. She is still a clinician. She is a PhD board certified nurse practitioner and researcher. She has spent the last 20 years developing protocols for oral care. And then we have our famous Cindy Sullivan, who's a nurse practitioner and the clinical leader. She has 3 decades of working with neuroscience, nursing, acute care, program development, and she previously served as neuroscience clinical specialist for Johnson & Johnson. She's supporting us as Oral Clean's VP of clinical affairs. And she and I have worked closely together in the field, and I very much appreciate her customer interfacing skills as well. So we will start the PowerPoint now. I will share it, and Gary will start, and then Gary, you just tell me when you want me to click to the next slide.
Sure. Thank you.
Stay out of trouble.
Somebody needs to mute, please.
Mikey, you need to mute.
Thank you.
Kids are home from school here, guys.
So Tracy, are you ready for me to start?
I'm ready. Can you see what I'm sharing?
Yep. Thank you very much. So my name is Gary, and I'm the CEO of Oral Clean. Tracy and Debbie, thank you again for allowing us to present to your team. We had a nice presentation on Thursday with some good Q&A. And what is Oral Clean? So Oral Clean is the most advanced and comprehensive oral care system in the world today. Let me just show you that it's a handle that has illumination, and you can see inside the oral cavity. And it also has a razor blade technology. The beauty and the magic is kind of in this brush head. So when the product is actually put together, the cornerstone product, I should say, it looks like this. It's connected to suction. Hopefully you can see that suction. So you got your suction port there. It comes up here on the distal tip. Oscillating toothbrush head and illumination. So instead of the complicated oral care procedures, now it's very simple with a one-handed procedure. So we'll get into more detail around that on the next slides ahead. So Tracy, if you want to move to the next slide, that would be great. So we're setting a standard for dependent patients. So what is a dependent patient in oral care? It's basically a person who cannot manage their own oral cavity or brush their own teeth. And there are plenty of those patients, not only in the hospital, but literally 13 million at home who cannot brush their own teeth. So Oral Clean is setting a new standard for this comprehensive package of products to make it faster, safer, and superior for people who are doing oral care on others, and in the hospital, that would be clinicians, obviously. So the next slide, Tracy. So why are we superior? Why do we make that claim? So you can see on the left-hand side of the screen, we have kind of antiquated tools. They've been around for decades, nothing extremely new or interesting there. Manual toothbrush, suction, which is sometimes referred to as a yank hour. That's not, well, that might be a yank hour, it's curved, but a yank hour and foam swabs, and that's kind of what's used today. And nothing's been really changed in this marketplace for a very long time. We have oral care as a low priority here. I'd like to say it's just a three-handed procedure, and it's a little bit of a tricky procedure, even though it doesn't seem like it would be. It's a little tricky to get it done correctly because you can't, you want to see inside the cavity. So within 48 hours of admission, you can potentially go from gram-positive bacteria to gram-negative bacteria. Gram-negative bacteria is pathogenic, and we want to try not to have pathogenic bacteria in the oral cavity to the largest extent that we can. Next slide, please. And so us versus them, wanted to show you the kit. So this is our I can't really see that too well, can you? So this is our 3-day kit. It's right here. You can see it's very, very small, 3 days of product there. And then you go to a daily pack. So after 3 days, you simply grab this little daily pack. That's all they grab out of the Pyxis system. And they have day 4 right on hand. So we have a very small footprint. As you can see, just one of the boxes from our competitor. We don't have Stryker on this slide, but Medline, their 24-hour kits are larger than our 6 days of product. And we'll get into that in another slide. So we're just a totally different concept. Next slide, please. And so we're the first comprehensive oral care system. And as I showed you, this is the handle with the brush head. And then we have a silicone type swab. That's the best way to describe it. It's not silicone, but it's that kind of material, feels that way. And it's a reusable 24-hour swab that they can medicate and take care of the oral cavity. Then we have a very novel tongue scraper, low profile. So you can get in, even if endotracheal tube's in, you can get in and scrape the tongue, which is a very novel concept as well, and is very well accepted. And then we have non-foaming toothpaste to keep the detergent down in the oral cavity so they can not only see what they're doing, they don't have a lot of foaming going on in their mouth or practically none. And then we have a gel. So these are enzymatic and they provide bacteriostatic properties and are preferred by oral care clinicians. And then finally, we want to keep the lips moist. And so we have just a regular lip balm, and that's a way to keep the lips from cracking and keep them healthy. Next slide, please. And so why Oral Clean? We got just the lineup here. So it's patient safety, nurse productivity, or making it easier for the nurses to do the procedure, reducing or improving, decreasing the bacterial load, a significant waste reduction, and cost that's equivalent, which really surprises clinicians, cost that's equivalent with our competitors. So we'll go to these 5 slides now and quickly discuss them, and then we'll turn it over to Cindy. So on the left-hand side, you'll see the perfect, wonderful, beautiful oral cavity. So that's the mucosa, the gingiva, the tongue, and the teeth. And you want to make sure you take care of those 4 areas. And so we had our nurse scientist to do a study on oral care patients they were intubated and ventilated patients, and just providing this comprehensive oral care package, it was able to reduce the events by 50%. And then again, as we mentioned earlier, we have these enzymatic products, which provide better oral care, and Cindy will get into that. but chlorhexidine is what you're seeing below. Chlorhexidine dries the mouth out. Not only that, if you got an endotracheal tube in, your mouth is open already. And then there's hospital-acquired pneumonia, which is another area, a huge area where people have the propensity to go upstream and get pneumonia. So you want to keep this oral cavity as pure and good as you possibly can. Next slide, please. So this is a little bit of a fun slide. So take it as a grain of salt that it is. So on the left-hand side, we have standard of care. Obviously, this is not the standard of care. No nurse is going to put a breath light in their mouth. But what we're trying to establish here is this is a three-handed procedure. You need to suction. You need to illuminate if you're going to look in and see where you're brushing, and then you have a manual toothbrush. And so it's kind of a tricky procedure in that it's a three-handed procedure, and nobody has three hands last time I checked. And so again, you can see on the right-hand slide, we have this elegant product, which is one-handed. They turn it on and away they go. So it's just elegant, comprehensive, and easy to use. And 95% of the nurses at our rollout hospital preferred Oral Clean over the products they were currently using. I think 95% is as good as it gets. So 19 out of 20 nurses preferred this product, and getting 100% kind of would be unusual, I would think. So anyways, next slide, please. Okay. Thanks, Tracy. Next slide, superior efficacy. We talked a little bit about this. Cindy will get into that as well, but having an oscillating toothbrush head, which is what you're seeing here, and you're seeing that advertised a little bit like at Costco with the new Philips toothbrush. You're seeing this move back to this type of brush head, and so you can go ahead and suction and brush every tooth, and it's easy, and it greatly reduces the bacterial load. So nurses love using this product. Next slide, please. Okay, and waste reduction. So I did a little mock-up here for fun. So this is the average ventilator patient will be on in the hospital 6 days, sometimes more, sometimes less, but on the average 6 days. This is 6 days of product right here. I tapped in 3 daily packs to the back of this. So you'll see this is an entire 6-day load of product. And again, it's 2.3 liters of uncompressed waste, excuse me. If you look at Medline, the equivalent product demand there would be 67 liters of uncompressed waste. So we are the greens, on top of all the other benefits, we're the green solution. And in the hospital environment today, people love the green solution. We do too. And so we're very excited to produce a product that greatly reduces their waste by 25 to 30 times. Next slide, please. Saves money. So the left-hand side of the slide basically talks about anytime somebody bumps up into the pneumonia category from where they are not having pneumonia, the additional cost to a hospital for one patient bumping up to pneumonia is $43,000 per patient, just to get them back to, if they don't pass away, to get them back to baseline. And of course, you've got the cost even when things are going bad. It's an $8.3 billion lift in the healthcare system annually, the pneumonia patients. So it's a very, very expensive, a high level of care that's required to keep these patients healthy. And as you can see on the slide below, you've got these daily packs. And so interestingly enough, as we go out in days on the right-hand side of the slide, you'll see our cost continues to be reduced. So let's say you've got somebody at a VA hospital that's on for 10 days. That's all they're doing after day 3 is grabbing this daily pack, and it continues to reduce the cost. And we're equivalent in cost with our competitors, as I've mentioned earlier. Next slide, please. That might be so. Cindy's going to take it from here. She's going to go through a little bit more of the clinical stuff, and then do a demo of the product, and then we'll take questions and answers. So Cindy, if you want to take it from there.
Thank you, Gary, and thank you, Tracy. It's really a pleasure working with you. So Gary has been talking about hospital-acquired pneumonia, and we want to make the connection between hospital-acquired pneumonia, or HAP, and brushing teeth. So what we know from the research is that the bacteria found in the lungs of patients with pneumonia in the hospital is genetically identical to the bacteria found in the mouth. And that bacteria in the mouth and the lungs doubles every 2 to 3 hours without brushing teeth. Pneumonia or hospital-acquired pneumonia is the #1 hospital-acquired infection. When we think about pneumonia, we think about ventilator-acquired pneumonia and non-ventilator acquired pneumonia. Regardless of how you develop pneumonia in the hospital, it's about a 10% mortality. Ventilator-acquired pneumonia is more studied than non-ventilator-acquired pneumonia, but when you get it, you have increased costs due to longer ventilation, longer ICU and hospital length of stay, and more antibiotics used. Non-ventilator hospital-acquired pneumonia doubles the length of time for discharge, so you have increased costs again. You also have increased costs, and the important part about non-ventilator hospital-acquired pneumonia is that the majority of pneumonias in the hospital are on people that are non-ventilated. So if we go to the next slide, here's the connection between reducing pneumonia in the hospital. So these are clinical practice recommendations that come out periodically, and the last recommendations came out in 2022. They're from the Society of Healthcare Epidemiologists, 2 infectious disease societies, American Hospital Association, Joint Commission. But essentially, they go through strategies to prevent ventilator and non-ventilator associated pneumonia. And for both categories, an essential, low-cost, high-impact practice or intervention is to brush teeth. So they recommend brushing teeth in both non-ventilator and ventilator-associated pneumonia patients. The other thing that is new for these guidelines is that you should brush teeth without using chlorhexidine. So Gary talked about that initially. It is drying, but newer research has shown that chlorhexidine may increase morbidity and mortality. So when Tracy and I went in to roll it out at the Tampa VA in the rehab unit, they were still using a kit with chlorhexidine in it. So having that conversation about the new practice guidelines and research is important when you're talking to the clinicians at the bedside. And ultimately, daily toothbrushing is associated with less VAP rates, shorter mechanical ventilation, shorter ICU length of stay, shorter hospital length of stay. So if we go to the next slide, I talked more about VAP. This is where the VA is on the forefront of research for non-ventilator hospital-acquired pneumonia. So the nursing scientists there in 2018 did a project, more like a quality improvement project, and at the Salem VA. And they looked at all of the patients with pneumonia prior to the project. Then they implemented a standardized oral care protocol. And over a 19-month period, they saved $2.84 million. They saved 13 veteran lives. They reduced their rate of pneumonia and sepsis. Those patients had a shorter length of stay. They had a higher chance of going home instead of to like a SNF or a rehab. And so the VA itself saw significant healthcare cost savings, reduced the amount of antibiotics, and then the lower need for transferring those patients to the ICU. Fast forward a few years, they rolled this concept out to 8 more hospitals. And then in 2022, they came out with this hospital-acquired prevention by engaging nurses, HAPPEN program implementation guide. And this is really a blueprint or a protocol for how to roll out a comprehensive oral care program within each institution. So they provide this information to all of the institutions in the VA. And if you go to the next slide, what you'll see online is that this HAPPEN project received tons of awards and recognitions within the VA. They have a number of partners within the VA, and state that there's 155 successful adoptions in the VA. So it's interesting when you go into an account, which we did, and we asked them, the nurses in the account, if they've heard of this. And I only have experience in a couple of accounts, and neither one of those accounts knew about the Happen project. So it'll be really interesting to have your boots on the ground and understand what you're hearing out there. But this is, we feel that, or we know that Oral Clean is the infrastructure that they need to even heighten their success with this project. So with that said, that's the connection, but if we want to, we can do a demo right now. And I don't know, Tracy, did you want to get rid of the, yep. So Gary showed you the product. It is in this little toolkit. The toolkit itself, if you have it and you've received it and you have it in your hands, that would be great. But you can see there's an upper lid and a lower part to the kit. The lid itself has ventilation holes in it. The lower part of the kit is biodegradable, recyclable, and water resistant. So we can use it to store a product that's even been used, and we do reuse some of our products. There are key reminders on the front of the kit that tell you how to reuse the products, how to clean them, and what you should do with them. There's an area here at the bottom where the nurses or PCTs, whoever opens the first kit, can put the patient sticker. We tell them to date it because this kit is good for 15 days. The kit does not get replaced until the batteries and the brush handle die. And this kit travels with the patient throughout the hospital. It's the same comprehensive oral care protocol, whether you're in the ICU or on the floor. So that doesn't change. So you have this continuity of care regardless of where they are. When you, there's also, I'm sorry, there's a QR code on the back for Oral Clean, and there's also all of the ingredients that are in the products in the kit on the back that are very easy to read. And even when you're older, you may not need your glasses. So when you open the kit itself, and so if you have your kit, go ahead and open it. The first thing you're going to see is the electric toothbrush. So we'll kind of go through it, not as in detail, but we'll go through it using the way they do the comprehensive oral care protocol, which is assessment, clean, and moisturize. It's very easy. But when you open it, you'll see the electric toothbrush displayed. If you take the brush handle out and you hit the push on the big power button, you'll see the lights come on. And it's working. The little power button shuts it off. The motor is located in the upper portion of the handle, and the 3 AAA batteries are located in the lower portion of the handle. You never need to break the handle apart until the batteries die. So to assemble it, you take the brush handle, you put it on, I always say the 4 o'clock position. So it goes on sideways. It slides down the post and then it clicks in place, and then you turn it. Don't over twist it. You turn it so all of the blues line up in this nice little line. If you over twist it, you'll render the brush handle or the brush head itself useless. So nurses like to twist hard. So it's just telling them it's a gentle twist and lock. On the back part of the handle, you see, or the brush head, you see the barb. This is where the suction goes on that Gary just showed you. There's a clip here to clip the suction in if it fits. To control the suction, there is a port. You need to occlude the port with your finger. The suction itself comes out below the oscillating head. The suction is equivalent in power to a Yankar suction. It is not a Yankar suction. A Yankar is built and it's ergonomically so it can go in the back of the throat. This suction is built to collect the debris of brushing. So before nurses even go through the oral care, comprehensive oral care protocol, the oral pharynx needs to be cleared of all secretions. The head of the toothbrush is an oscillating head. An oscillating head is the most effective way to remove plaque. Plaque is the bacteria that sticks to your teeth, or the biofilm. And this is the way that we remove it. When you brush teeth with an oscillating toothbrush, you glide and slide across the teeth. You don't scrub. Otherwise, you lose the effectiveness of the oscillating head. So that's the toothbrush. So once they take the toothbrush out, they're going to have it set up. They're going to have it connected to section 80 to 120 on the wall. Then you have this piece of cardboard that we tell them to discard. So they discard this. When you open up the kit, you can see all the supplies are in the base of the kit. The initial kit has 3 days of supplies. So they're going to brush twice a day, and they're going to discard their brush head after each use. So there's 6 brush heads. And then Gary already indicated that the swab is reusable. There's 3 swabs. And then there's a tongue scraper, toothpaste, mouth gel, and lip balm, and instructions for use within the kit. So after 3 days, all of the supplies are going to be depleted. And on days 4 through 15, until the batteries in the brush handle die, they're going to just every morning get a daily replacement pack. That's it. So that is the kit itself. Now, as you go through the assessment, when they take this out of the initial part out of the kit, they'll use the light for the assessment. The next part is to clean the mouth. So the first thing you want to clean is the tongue, which holds a high degree of bacteria. So this is novel to this kit. No other kit has a tongue scraper. Gary talked about the tongue scraper. The tongue scraper is good for the life of the kit. When they scrape from back, they get it wet. Anything that goes in the mouth gets wet. Scrape from back to front, wipe it off between passes, they're done. The next thing they're going to do is brush teeth. We already talked about the way that you brush teeth. You slide and glide for 2 minutes. Prior to putting it in the mouth, they're going to put on the toothpaste, a pea-sized dollop on it, get it wet. The toothpaste is antibacterial and antifungal. It has the same natural enzymes that are found in our normal saliva. It also, as Gary said, is detergent free, so it doesn't foam and bubble and dry and harden in the mouth like other toothpastes, and it's easy to rinse off. So they brush for 2 minutes, they're done. So now they've assessed, they've cleaned the tongue, they've cleaned the teeth. Now they're going to moisturize. This swab is silicone-like, and it feels that way. And it's thermoplastic elastomer, but it is reusable for 24 hours. They open it on day shift. They throw it away on their last use on night shift. The mouth gel itself is enzymatic, so same natural enzymes that are found in saliva, and bactericidal and fungicidal. It's also water-based, and it has a lubricant, so it sticks to your mouth and keeps it nice and moist. So now they've moisturized the entire oral pharynx and tongue with the moisturizer. And then the last thing is the lip balm. And then put the lip balms on the lips to protect them and protect any cracks or breaks in the skin. The final thing of the kit is the instructions for use are in it. It's very handy. It goes through everything I just talked about. And then there are 2 QR codes on the back. And we had asked you guys if you had time to go ahead and review those QR codes. It's less than 5 minutes of instructional video time. One is on the comprehensive oral care protocol and one is on components. So once they're done, they have 3 things to clean. The first thing to clean is their tongue scraper. So you just want to run it under water and then clean it off and then put it in a paper towel or a washcloth in the bottom of the kit. Everything else is covered in plastic, and so it's protected. The next thing you want to clean, this can be used every 2 hours or however their protocol is to moisturize. Clean this off really well, put it in the bottom of the kit, the swab. The last thing that you want to clean is the toothbrush itself. So The brush head is one and done, so they discard this after every use. It has suction that went through it. This is the most important part to clean. Because the motor is housed under here, you want to take a purple wipe or their antibacterial wipe, clean the post really well so none of the secretions get into the motor, clean off the brush handle, put it in the kit. So finally, the brush handle dies and can no longer power the brush head. The way to remove the batteries, if they need to dispose of the batteries, is to break the brush handle in half, open this up, and I'm not going to do this, but there's 2 tabs here, and you just click those together. You'll hear them click, and then this pulls out, and it's battery carrier, and it has the 3 AAA batteries in it. Throw this away, throw the handle away, and then throw the kit away and start over again. So that is the kit itself. And I think we can take some questions here, Tracy, or whatever you think. You're on mute.
Yes, let's see if there are any questions right now. There's something in the chat. Oh, these are just folks that are reporting through Otter. Any questions so far?
Yes, I have a question. Yes, so can we offer this to hospice, or is it just to hospitals and that's all?
We can offer this to you know, whomever we see fit. I don't know how well it might be received by hospice. I myself have never called on hospice, but we would, encourage you to try it and give it a whirl. We're seeing some luck in ICUs. Actually, DJ was able to, she was on our call on Wednesday, and by Thursday she had established contacts with ICU nurse manager, and we're going to set up a call. She's going to gather those who need to be involved on a call with these great folks from Oral Clean. Cindy and Kurt have had luck at the spinal cord injury in Tampa, spinal cord injury unit in Tampa at the Tampa VA, and that's how VMD got involved, because we needed someone to actually implement it, and then from there, we have our next step with Tampa VA is the medical ICU unit, soon to be surgical ICU unit, and the cardiac ICU units.
Something to keep in mind, guys, with regards to hospice is that typically they're not looking to spend money on prevention. They're looking to keep the patient comfortable. And if this product keeps them comfortable, as when we did our trial, you noticed, a wife noticed that it was much more comfortable for her husband, then that's the approach that you would want to take with hospice. But for long-term care and rehab facilities, that this would be a great opportunity as well. But it would have to fit in with their DRG because I do not believe we have reimbursement on this. Correct, Gary?
No, it would be part of a DRG, a bundle part of the DRG. Yes.
So I have a question, Cindy. So I think as you were going over how the product is used, so is wall suction required?
No.
No.
If they don't want to use suction, they don't have to use suction. We see both on the floors where they may or may not use suction.
Okay.
I just used it with a nurse in Phoenix a couple of weeks ago in a rehab unit, and that patient could spit, but he wanted it for the light, and the patient wanted it. After we got done, he's like, my mouth hasn't felt this clean. I've been in the hospital for 2 weeks. So, and yeah.
Okay. And the reason I asked that question is because in thinking about the VA and thinking about patients, any patient, right, that's immobile and compromised, there's the potential for for pneumonias. And so if you're talking about a VA patient that's being discharged where the VA is paying for either home health or they're paying for those beds within a long-term care or rehab facility, it might be something that can be
Yeah.
ordered to follow the patient, while it wouldn't be a prescription per se, it could be ordered by the physician, for X number of weeks or months or whatever the case may be, in which case the VA would then be paying for it and it would be shipped to the patient's home or following them to the rehab facility or at the long-term care SNF, whatever the case may be. So I was thinking about it in terms of the VA patients and something that would be used a bit more long-term for those patients that are immobile and compromised. And we know they're going into environments where, there may not be that that Q2 turn or whatever. And so if you don't create that pulmonary toilet, then you're going to potentially have pneumonias.
Right.
Yeah.
Keep in
think
mind,
would-
guys, that they can go home. So we today have a urinary catheter that is external and uses suction. And it's very comfortable. There's no adhesive, there's no damage to the skin. It's just a constant suction. The patient barely notices that it's even happening. And we sell that direct to VA, to vets' homes, as a script from urology with a Gomco suction machine. So it's about a $325 machine. We usually sell them about 4 catheters so that they don't have to come back until every month, because in hospital the catheter stays with them 15 days. At home it'll last much longer. So that is an opportunity too, as you're talking with home-based health at the VA, and coordinate with their physicians to see if when they're discharged, this is something that could be ordered through prosthetics. They order it to VMD and we ship it direct to the patient home, and you do have the option of adding a suction machine or device if wanted.
Excellent.
Kay, I would make your observation is really good, and I would just say that there is a propensity for patients in long-term situations to end up bouncing into the pneumonia category. So,
Right.
right. The senior management at VA is well aware of that, but we're just rolling out right now. Our goal is eventually to be selling this product at home to people on long-term that have a long-term need, because you want to keep them out of the hospital, whether that's VA or in the private markets. So,
Right.
very, very good point, Kay.
It's just I love the clinical story around the product. It seems like
Right.
such a simple thing, but the clinical story around it is super powerful, right? You're potentially saving lives. You're reducing, the incidence of these pneumonias, and there's a financial impact, right? And so a VA patient is a VA patient. Doesn't matter where they are physically, whether it's in the hospital, in the ICU, on the floor, in long-term care, in the home, it's their patient. So do you want so I would tell that clinical story from a big picture perspective. Here's how we can serve your patient population wherever they happen to be.
Agreed with that.
Any other questions for right now? Or should we jump back to the PowerPoint?
Yep.
Okay.
Great questions, guys.
Yep.
Very. Is this the slide we want, Cindy, or the next one?
I think the next one, Tracy, and I think maybe keep going. Yeah.
Okay.
Do you want to talk about this?
Yes, I will. Yes. Okay, I really like that comment there, because you verbalized what we're all sort of thinking, which is the VA patient is a VA patient no matter where they are. So that's powerful. So some of the things that we've heard in the field are there are too many steps to remember. This will take too much time. But I think when we remind them of the why, just like we do when we're when we're asking customers to change any type of behavior or protocol, when we're trying to get our kids to do something that we want them to do, right? We often have to give them the why. So if we go back to the clinical reasoning, if we don't remove the plaque, the patient is very likely to to end up with hospital-acquired pneumonia. So if we go back to the why and the evidence, then we remind them we're giving them a comprehensive oral care kit. Every tool that they need is in the kit for the same price, sometimes less if the patient is staying longer, the price is reduced. It's a completely different animal than how they're trying to approach oral care currently.
Yes.
What's that, Gary?
Oh, my bad. I thought it was on me.
Oh, sorry. So this is interesting because I've never had clinicians in all my years of selling. I cannot remember clinicians asking me, how much does this product cost? The reason being is we are, like I said, bringing them a completely different product than what they're used to. They're used to a cruddy little green swab foam. The patient can bite it off. They can aspirate that. Maybe it has suction. Maybe it has chlorhexidine gluconate in it, which is not helpful for oral care, actually a detriment. So they're comparing junk to a Cadillac, and they're concerned about price. So once we explain to them that their daily cost at the most is the same as what they're paying now, sometimes they don't really believe us. But when you start quoting them numbers per day, we have to quote in days, daily costs. Because remember, the kit, the original kit is good for 6 days. You have 3 days. So that's the most the Oral Clean product is going to cost. And it's about $23 per day. That's it. And then if the patient stays longer, which most dependent patients are staying, the average stay in the ICU, I think, is 5 days, then that cost keeps going down. It's a reusable product. It's partially reusable. So if you speak to that, it helps. But you do need to talk about it. Even if they're not asking, ask them, are you curious about the price? Because I guarantee you they are. It feels wasteful for some folks to throw out a electric toothbrush. And that's when we go back to Gary's great slides with all of the footprint. What actually are we wasting here? And also remember, reusable product. And then we go into the fourth objection, which is, isn't reusing a product increasing the risk of infection? So I like to keep this verbiage here from Oral Clean handy. The oral cavity contains more than 700 species of microorganisms. Our infection control team has evaluated potential reuse and found no increased infection risk when following established standards and guidelines. All components are stored in the kit in protective plastic to maintain safety, while reusable products are air drying. And then sometimes they think, I guess if we're talking to procurement, they think it's too many SKUs. It's 4 SKUs, 4 SKUs. So you have the Oral Clean kit, you have the daily packs, you have the toothpaste, the enzymatic toothpaste, and the enzymatic gel, and that's it. That's all you have. I just want to say that I really think that this product is one of the most important that we have in our bag to really impact and save lives especially for our veterans. I have a little bit of an elevator speech that I'll email to all of you, but basically the bacteria that they're finding in patients that have hospital-acquired pneumonia, 85% of the time is bioidentical to the bacteria on the plaque in the teeth. The only way to remove the plaque is to brush. And if we could give you, Mr. or Mrs. Customer, a comprehensive oral care kit that costs the same or less as you're paying now, would you be interested in taking a look at it? And remember too, or maybe you're not aware, but when they are doing the minimal oral care that they're doing now, they're having to grab tools from different areas. We're giving them everything that they need in one kit. Any other questions? I think we're done with the slide. Oh, here we go. This is a competitive slide. And this speaks to what I just said about everything that they need is in one kit. Gary, do you want to close
Yeah,
us?
well, that's one of my favorite pictures that we have. And of course, you're seeing somebody that has, you know, a trach tube in, and, you know, it's a tight space, and you're seeing the one-handed procedure, the other hand's free to comfort the patient or to take care of anything they need to take care of. And the nurses will go to a place where they love doing oral care because they want to do oral care. They care about their patients. So this is one of my favorite pictures that we have in the armamentarium. And I want just thank you all for the time and attention. Debbie, Tracy, and the organization, we look forward to working with you.
Thank you so much, Gary. Great product, great team lead, great support here, guys. Like you said, DJ ran out right after the first training, and he was able to secure an opportunity to get Oral Clean on a virtual meeting with some leadership at his local VA. So don't hesitate. You've got information online. You've got your samples. You've got the talking points, and Tracy can help if needed as well. Have a great day. And again, thank you, team, for the presentation.
But one more thing, I forgot, Gary had some luck too right away, and he found, I can't remember which VA it was, Gary, would you cover a couple, I think, but
San
you want to
Francisco.
tell your story real quick?
Uh,
You're
am I on
muted.
mute?
There you
Okay,
go.
now am I mute? Okay. I'm at, well, it's a San Francisco VA that I meet on the 18th, that I'm actually going to introduce the product to the nurse that's heading up their oral protocol.
Yeah,
So
so that's,
Or
sorry,
how
go
did
ahead.
you get that opportunity, Gary? What did you
I went
say?
to the head nurse. I just went to the head nurse, the head of nursing. She then told me to go speak to the nurse that's running the protocol for their oral procedures and oral hygiene procedures. And so again, I just went, met, I introduced myself. I had the package in my hand. I showed it to her. The 18th, I guess that's Thursday. I have an appointment with her to sit down with one of her colleagues to go through the whole, what we just did right now, this presentation to present it.
It's awesome. And if we learn, hopefully we'll find more Oral Clean champions in each VA, and maybe we'll hopefully find the national leader like we did with our SedMed product on the safe patient handling. So we'll be sharing our stories and helping each other out as we go.
Hey, I do have a question, Gary. You said 19 out of 20 prefer oral clean. Who are the 1 out of 20 that do not? Why? What's the objection?
Hi, this is Virginia, and I can actually answer that question.
Thank you.
Yeah, so in that study, it was very interesting. It was a critical care nurse who did not prefer oral clean. And when asked, for a little bit more information, she said that she uses a manual toothbrush at home because she likes how a manual toothbrush feels. She self-disclosed that her dentist has told her she should be using an electric toothbrush. She's heard it's better, but she just likes the manual. And so how we dealt with that comment, because you may have a similar comment, was when you're a healthcare provider and you're entrusted in taking care of people, you really need to put your personal bias aside and use what research demonstrates. and there are decades of research that support the efficacy of an electric toothbrush. Does that answer the question,
Yeah,
Gary?
it sure does. No, I thank you. I appreciate it. I was just
Yeah,
curious
sure.
to know why.
Yeah, yeah. And the only
And
reason
so
I
on the
answered was
18th,
just, yeah,
no,
of
thank
course.
you. I
And the
just
only
wanted to
reason I,
hear.
Mhm, right, right.
The only reason why?
The only reason that I interjected, I had my hand up, was because I saw your question in the chat, and I'm the one who actually spoke with that nurse. So,
Thank you.
I might make note, Virginia is Dr. Virginia Prendergast. She's a PhD and got her PhD in oral care. She's one of the leading experts in the world on oral care. So we're very fortunate to be working with her.
She's the Chief Scientific Officer of Oral Cleen. Okay.
Thank you,
I would
Tracy
like
and
to
Debbie.
get Dr. Pendergast on a call if we could with our CMO to have them review the product, because if he has referrals or any questions for our team, that would be really helpful for it to be physician to physician.
I'll set it up, Debbie.
Thank you. And thank you, doctor.
yeah, sure. And I'm a PhD, not an MD.
Okay.
Okay, thanks.
Thank you, Tracy.
Thanks,
And
everybody.
Yeah.
Debbie.
Thank
you all
you.
for being
Thank
here.
you.
Appreciate you.
Yeah.
Happy
Good luck on
holidays.
the
Have a great
18th.
day.
All right, bye.
Bye. Thank
Bye.
you.